My name is Dr. Alyssa Gremban, and I am an occupational therapist. Occupational therapy is very unique in that it's the only healthcare profession that helps an individual recover from an injury, a disability, or other diagnosis using what is most meaningful for them. So using daily tasks therapeutically, and that's what we call occupations. So occupations are anything you do throughout your life that are meaningful to you and that you need to do. So for example, another example of an occupation might be taking care of children, or going to your job, or caring for your home. So OTs are very unique in that we use those daily tasks therapeutically to help you recover from an injury, from a disability, or a related diagnosis. So instead of hitting the gym after you have a shoulder injury, we use daily tasks to help rehab that same shoulder in a very unique way, which is what I love the most about it.
And what is your current level of education?
So I currently have my bachelor's in rehabilitation psychology from the University of Wisconsin-Madison, and I also have my clinical doctorate in occupational therapy from Belmont University in Nashville, Tennessee.
And how long have you been working in your field?
So I've been working as an occupational therapist for 3 years, but I've been in the field of pediatrics for 8 years.
And what does a typical day look like for you?
So I currently have my own private business, and I see children in both the home and school. So I'll just kind of go over what a typical day looks like in the school-based setting, because that is where I see the majority of my patients. So typically I arrive to the school about half hour before my first patient, and what I do is I review what their goals are for therapy, and I review my environment to set up my environment so that I can really be successful when I'm working with these children one-on-one. Once I've reviewed their goals and the environment, I go and I pick them up from class, and then we begin our one-on-one therapy session. From there, each child is very different in what their therapy goals are, but just some common goals that we work on in the school-based system are helping children improve their handwriting, helping children improve their visual skills, their motor skills. So each child is very unique and different. But what I love the most about OT is the fact that we get to use what is most meaningful for children to help them reach their therapy goals. And the thing that's most meaningful for children is play. So I get to use a lot of purposeful play to help children meet their individual therapy goals. Once we're done with that one-on-one session, it's about a half hour to an hour, then I take them back to their classroom and they get to get back to learning.
What is the best part of your profession?
I love that as an occupational therapist, we get to use what is most meaningful to the client or the child. So that is really the defining factor of occupational therapy, is we get to use daily activities and what is most meaningful to the client therapeutically. So for example, if I'm working with a child on handwriting, what I did most recently with one of my children was they were a big fan of Star Wars. They love Star Wars. And typically handwriting is a very difficult task for most children. They don't want to do it. So what we did was we integrated Star Wars into our handwriting activities. So we wrote words like Yoda, Star Wars, and things like that. And it was a very, very motivating experience for that child. So that is something that I love the most about OT, is just being able to use what is most meaningful for the client.
On the other hand, what is the most challenging part of your profession?
Yeah, so I think the majority of OTs get into this profession because we are empaths. We really love taking care of people and being healers as far as that is concerned. So we're very connected with our clients and our patients. So sometimes it's very difficult to see a client struggle or be in pain. That can be very heartbreaking. So you definitely have to have good self-care and balance in your own life as an OT, but it's so worth it when you see them come out on the other side of it more independent and stronger for it.
Okay, so that kind of leads into our next question, which is, how is your profession important to our community?
Yeah, definitely. So I think from the individual perspective, OTs really help individuals get back to doing what they want to do and what they need to do. So whether that is getting back to their jobs following an injury or a disability, whether that is being more independent in the school through because they might have handwriting delays or something of that nature. So we're really getting individuals back into the community and getting to do what they love and need to do. In addition to that, OTs do work on the community-based level. We love advocating for our clients, making sure that their needs are met, whether it's in legislation or just getting them access to needed resources within the community. So as OTs, we're very much involved in the community, even though a lot of people don't know what we do 100% of the time.
Do you have any advice for students who are interested in following your career path?
Yeah, I think I would highly recommend, if you're interested, to one, you can go to our National Association website, which is aota.org, the American Occupational Therapy Association. Many people don't know what occupational therapy is, so this is just a really great way for you to explore more about our profession, what we do in the different fields that we work in, because we work in so many different settings and different capacities. I would also recommend, as you get older, to look into opportunities to observe with an occupational therapist and actually see what they do day in and day out, because like I said before, it is very unique. So those are the two things that I would recommend doing now if you are interested. That way you can get a little bit more exposure and make sure it's what calls to you.